So today we will be presenting on the nursing theory that we chose from our changeability and
Tyler Anderson.
And the nursing theory that we chose is Madeleine and Leininger's cultural diversity and universality theory.
So to start off the background with Madeleine, after graduating from a small town high school in southern Nebraska, she discovered that her aunt was diagnosed with congenital heart disease, which led to pursue a career in nursing. After leaving the cadet corps with her sister, she pursued higher education, which led to her completion of multiple undergraduate degrees at Creighton University and Mount St. Scholastic College. In 1954, she earned her master's from Catholic University of America, and she did not stop there, because in 1965, she became the first professional nurse to earn a PhD in anthropology. And she became the first to earn her degree in anthropology because at the time, when nurses were pursuing to follow a higher education, they pursued the PhD in Bachelor of Science. So instead of going the nursing route with her PhD, she went the anthropology route, like the study of social studies and human behavior. So while Madeleine was working in child guidance home, she experienced a culture shock and began to understand that children's behavior patterns had a lot to do with their cultural backgrounds. After identifying understanding culture to be the key of better nursing, while being a psychiatric nursing director at the University of Cincinnati, she used the resources there to further her knowledge on social studies and how it related to nursing. While on an eye-opening trip to New Guinea, she also noticed the importance of knowing a patient's culture and background and how it impacted nursing care, which is very relevant to how she used her nursing techniques and used to better understand her clients.
And to start on transcultural care, cultural diversity and universality theory, or often known as transcultural care, is a practice used to better understand how to care for different cultures outside of your own. Her travels throughout the country and even outside of other countries gave her own eye-opening experience and understanding on the importance and how to treat patients from different cultures. She felt that being able to understand the patient's culture was so important that she implemented it to be a course at the University of Washington. She was the first in the 1960s to coin the concept of culturally congruent care, which was the goal of the theory of cultural care, and today the concept is being used globally. She believed that patients are more likely to follow recommendations for health and healing when their caregivers understand and respect their cultural norms.
And on top of so transcultural care is also another word for cultural diversity and universality theory. So as it grown, it would just all put under one umbrella, but transcultural is basically the umbrella word for cultural diversity and universality theory.
All right, and to apply this to the nursing process, the assessment and diagnosis would be nurses should access the patient while not assuming cultural beliefs, so not going in and like judging them from what they see with their eyes. In other words, they should perform interview style questions to get to know the patient, and then plan an appropriate way to take care of the patient based on that, so that the nurse wouldn't offend the patient based on their cultural beliefs or their cultural norms. Getting to know the local customs helps nurses provide appropriate treatment. How it relates to our philosophies. Being genuine and getting to know your patients as a nurse rather than just being a nurse for just the pay is very important, because some people tend to deter from the fact that nurses are there to care and get to know the patients and to treat the patients other than just getting a higher pay grade. Leininger's cultural care theory explains how nurses need an understanding of patients' culture to give them the best care to them. Our philosophy on wanting to develop a career in nursing is based on wanting to become a nurse, so that we can be an outlet for our community, not only being someone that minorities like ourselves can trust, but to bridge the cultural gap in places where it is needed. Our philosophy relates by recognizing that there is a gap in cultural care, and having someone that comes from it or even learning about the cultures can push nursing in a positive direction. So just being a opening ear or someone that looks like you can motivate your patients to be more open and more trusting to you so that you can apply the right health for your patients.
And it related to my philosophy because my philosophy of getting into nursing, I wanted to be the person a minority can look up to and see, you know, that it's not all, you know, one type of nurse, you know, that we all have different type of knowledge and we have different type of understandings of normalities to different cultures. And with understanding the normalities, it helps to provide better care. And so me getting into nursing, I feel like I bring a type of knowledge or normal to different minorities and patients.
Alright, and this is our reference page of where we got all our information on Madeleine Leininger's transcultural nursing theory. And this will be the time where we ask if anyone has questions on the theory that we chose.